Welcome to the deep dive. We're jumping right into some fascinating source material you shared with us today. We're exploring something that's really shifting how healthcare works. Think about needing a specialist to look at your medical scan, but, well, they're maybe hundreds, even thousands of miles away. Today, we're unpacking how that's actually becoming pretty standard practice. It's called teleradiology, basically getting expert eyes on your scans from pretty much anywhere.
Yeah, and it's not just some sci-fi idea anymore. Teleradiology is actually one of the most developed parts of telehealth overall, and its importance has just, well, skyrocketed lately in healthcare. The basic idea is using technology, ICTs, information and communication technologies, to send health information across distances. So instead of moving the patient or the doctor, you move the data, specifically those really important radiological images, sending them so an expert can read them wherever they might be.
Okay, and the sources you shared really point to why this is so crucial right now. It seems there's this big growing gap. We're just producing way more medical images these days, scans and things, but the number of radiologists, well, it hasn't kept pace. There just aren't enough of them to read everything quickly.
That's exactly right. And there are a few things driving that surge in scans, according to the sources. I mean, first, the imaging tech itself keeps getting better, faster scans, higher resolution, so doctors use them more often. Then there are more conditions where imaging is key, like for stroke, heart issues, cancer diagnosis, follow-up. Population growth plays a role, naturally. And a big one, emergency rooms. They rely so much on imaging now for quick decisions, for triage. That's massively boosted the need for reads, especially after hours, nights, weekends.
So the consequence of that mismatch, too many images, not enough radiologists, it sounds pretty serious based on the sources. You see delays in getting reports back and potentially diagnostic errors creeping in, maybe because people are just overworked.
Exactly. Overwork, pressure, it can unfortunately lead to errors.
Yeah.
And it definitely contributes to radiologist fatigue and burnout. They're just trying to keep their heads above water.
Right, and that's where teleradiology steps in as a solution.
Precisely. It's a powerful way to tackle these issues. It helps deal with those shortages, globally even, and make sure interpretations are available, around the clock, even if there's no radiologist actually at the hospital or clinic where the scan was done.
Okay, so we understand why it's filling a critical need. Let's get practical. How does this actually work? Can you walk us through the steps?
Sure. At a sort of high level, it's pretty logical. First, you acquire the image, you do the scan, then transmission, you send it somewhere, then interpretation, the radiologist reads it, and finally reporting getting that result back.
Yeah.
So after the scan, the images get stored, usually in something called PACS.
ACS.
Yeah, picture archiving and communication systems. Or more and more, they're using secure cloud storage for this.
Got it. And the transmission part. How do the images physically, well, digitally, get from the hospital scanner to, say, a radiologist working from home?
So the images, along with the necessary patient info, clinical details, all they get sent securely to the radiologists. The sources mention two main ways this happens. There's synchronous transmission, which is like real time, think a live video call. But that's actually less common for just reading the scan itself, maybe more for a consultation. The main method, the one used most often for teleradiology, is asynchronous. It's often called store and forward.
Store and forward. Like mailing a package, but digital.
Kind of, yeah. That's a good way to think about it. The images and data are collected, stored at the site. Then they're sent securely forwarded to the radiologist. They review it later when they're available. Doesn't need everyone online at the same time, which is much more practical for these huge image files. It lets radiologists work across different time zones, different locations. They use secure internet lines, things like SFTP, to move those files pretty quickly and affordably.
And the sources mention different service models, too, how these services are actually set up.
Right. You can have an in-house model. That's where the hospital or clinic employs the radiologist, but maybe they work remotely, connecting to the hospital systems. Or it could be outsourced. The hospital contracts with a separate company, a teleradiology provider, who supplies the radiologist to read their scans.
What about the equipment the radiologist uses on their end? Does it need to be super specialized?
Well, for the official diagnosis, yes. The sources are pretty clear on this. Radiologists should ideally use diagnostic-grade equipment. That means proper workstations with special, high-resolution, calibrated medical monitors, designed specifically for looking at these detailed images. They might have this set up in an office or even at home. But images can be looked at on non-diagnostic screens, like a regular computer monitor, maybe even a tablet or phone sometimes. And this is important, the sources stress. That's really just for a quick look or for sharing info. not for making the final official diagnosis. The quality just isn't reliable enough on standard screens for that critical step.
Okay, that makes sense. So putting it all together, this technology, these workflows, what's the real impact? What good does teleradiology actually do for patients and the healthcare system?
Well, the biggest impact, arguably, is improving access to timely diagnosis. It just breaks down those geographic barriers. Think about people in rural areas or remote places where specialist services are scarce. Teleradiology means they can still get expert readings quickly. It's shown to make a real difference in reducing health inequalities based purely on where you live.
Yeah, and those examples in the source material really hit home, like the service in India.
Right, that Bengaluru provider reaching a hospital 3,000 kilometers away.
Incredible, bringing diagnoses to hundreds who might otherwise wait or go without. And in Australia, too, for remote indigenous communities. It's vital there.
Absolutely vital. And beyond just basic access, it speeds up decision-making. Getting those interpretations fast is so critical, especially in emergencies. Stroke, trauma, minutes count. The sources also emphasize something important: mandatory verbal communication for critical results.
Meaning the radiologist has to actually talk to the doctor?
Yes, pick up the phone or use a secure channel to make sure the referring physician understands the urgency immediately. It prevents critical findings from getting lost or delayed, which could have terrible consequences.
And I imagine there are cost savings involved as well.
There can be, yes. For patients in those rural areas, definitely. Not having to travel for hours to a city saves money on gas, hotels, time off work. And some studies suggest asynchronous telehealth, which includes teleradiology, can help avoid some unnecessary in-person follow-ups, which saves the system money too.
Plus, flexibility for the hospitals themselves, staffing-wise.
Huge benefit. Teleradiology providers can offer 247, 365 coverage. That's a lifesaver for hospitals trying to cover nights, weekends, holidays. It helps manage the workload, helps prevent burnout for the on-site staff, improves their work-life balance, while still ensuring scans get read promptly.
And it's not just for emergencies or general scans, right? The sources mention other applications.
Definitely. Emergency and rural access are key, but it's also fantastic for getting subspecialist opinions. So if there's a really complex case, maybe a rare condition suspected on a scan, the images can be sent directly to an expert in, say, pediatric radiology or neuroradiology, even if that expert works somewhere else entirely.
Oh, okay.
The sources mention things like telestroke programs using teleradiology to get stroke specialists involved quickly, even in smaller hospitals after hours. And teledermatology, where a GP might take a picture of a suspicious mole, send it secure, let distort and forward, and a dermatologist reviews it later.
Okay, so the potential and the benefits are clear. But like anything involving technology and healthcare across different places, there must be challenges, hurdles to overcome. What did the sources say about those?
Oh, absolutely. It's not always straightforward. A big area is the whole legal and regulatory side of things. Laws about who can diagnose patients remotely, they vary a lot between countries, even states or regions sometimes. And then there are tricky questions about accountability. If there's an error, who's responsible? Malpractice issues, and of course getting proper informed consent from patients for their data being sent and stored electronically. That's crucial, but adds complexity.
What about cultural things or language, especially in those remote areas you mentioned?
Yes, that can be a factor. Sometimes in rural communities, maybe there's lower health literacy or just, a bit of distrust or misunderstanding about how these remote services work. That can slow down adoption.
And the tech itself isn't always perfect, I assume.
Right. The technology can be a barrier. That India example showed it's feasible even with basic broadband, which is great. But inconsistent internet, unreliable connections, or simply not having the right equipment, those are still major roadblocks to widespread use in many parts of the world.
And cybersecurity, that must be a constant worry with patient data flying around.
It's probably the biggest worry. Patient data privacy and confidentiality are absolutely paramount, non-negotiable. The systems need really strong network security, software security to protect that information. They have to comply with international standards, national rules like HIPAA in the US, GDPR in Europe, and storing the data, especially if it's in the cloud, has to follow all the legal rules about protecting personal health information.
So with all those challenges, legal, cultural, technical, security, how do we make sure teleradiology is actually high quality and, trustworthy?
That's where having clear standards and guidelines is just essential. The sources point to examples like from the Turkish Society of Radiology. They've developed frameworks to ensure good practice.
What kinds of things do those standards cover?
Well, things like clinical reporting standards, making sure the reports themselves are clear, thorough, list the findings, explain why they matter clinically, maybe suggest diagnoses, point out any complications, just good, solid reports. Then communication standards, super important, especially for those urgent results we talked about. There needs to be a reliable way to communicate critical findings back quickly. Ideally, a direct conversation for anything life-threatening.
And how do they check the quality?
Quality assurance, that's really key. Often it involves peer review, other radiologists looking at a sample of reports to make sure they're accurate and complete, sometimes using scoring systems. Also, the qualifications of the radiologists themselves. They need to have the right training, the right licenses or registrations, and everyone's roles and responsibilities in the whole process need to be spelled out clearly and agreed upon. And finally, report management. Secure storage, easy access when needed, making sure all the key details are documented, who sent it, who received it, the doctors, the patient info, dates, secure signature. All that needs to be tracked properly.
There's also a point in the sources about the purpose of using teleradiology, something fundamental.
Yes, a really important principle. Teleradiology shouldn't just be seen as a quick fix, like, oh, we don't have a radiologist, let's just use teleradiology.
Yeah.
I mean, yes, it absolutely helps with shortages. That's a major benefit. But the main goal should always be improving patient care and maintaining high quality. Ideally, you'd still have someone, a radiologist or maybe a trained technologist, present at the site where the scan is done to oversee things, talk to the patient. Even if the final read happens remotely, it's about augmenting care, not just plugging a gap purely out of scarcity.
Makes sense. Okay. Looking forward now, what's next? What's on the horizon for teleradiology?
The sources point very strongly towards artificial intelligence, AI. You see, teleradiology already makes things more efficient by using different time zones, letting radiologists work from anywhere. But AI could be a much bigger leap. It has the potential to really boost how productive radiologists can be.
Right. AI in medical imaging is just exploding as a field right now.
It really is. And combining AI with teleradiology, that seems like the most promising path towards a long-term solution for those radiologist shortages. Shortages that could otherwise kind of limit the impact of all these amazing new imaging technologies. But naturally, bringing AI into this whole process, it creates its own set of questions and challenges too.
Like, what specifically needs careful thought when integrating AI?
Well, again, you have to navigate the regulatory stuff. How do you approve and monitor these AI tools? There are big ethical questions to consider. And critically, you need to make sure there's always appropriate human oversight. The AI might help, but the human expert needs to remain in control of the diagnosis. It's a tool, not a replacement.
So it's been quite a journey from, overcoming simple distance to getting super specialized experts involved from anywhere on the planet. Teleradiology is clearly this incredibly powerful tool. It's helping bridge gaps in healthcare, making sure where you live doesn't dictate whether you can get an expert opinion on your scans.
It really is powerful. And as the tech keeps evolving, especially with AI coming more into play, teleradiology, it's just going to become even more central to diagnosis and patient care. It's making expertise much less tied to a physical place. It's dynamic, it's essential, and it's improving healthcare outcomes all over the world.
Well, thank you for walking us through all of that in this deep dive. Really fascinating stuff.
Absolutely. And maybe here's a final thought for you, the listener, to ponder. As this remote technology gets more sophisticated, how do you see us striking that balance? The balance between leveraging all this amazing remote expertise, keeping that essential human judgment at the heart of medicine, and of course, always protecting your personal health information. How will that balance continue to shape medical diagnosis wherever you happen to be?